Hi everyone, this is Dr. Corolla Okogbaa with Louisiana Center for Eyes, where I help individuals meet their best vision so they continue to do all the things that they want to do, work, play, with having great sight. And so today I'm here to answer a question that I get often. And that question is, can my diabetes cause cataracts? And so we know that cataracts typically tend to be more an age thing, right? It's something that comes on the eyes with age as we get older. However, there's certain things that can accelerate the process of developing cataracts much earlier on. And one of the biggest factors is diabetes, especially uncontrolled diabetes. And so today I want to discuss that. So when as a diabetic, diabetes simply means there's too much glucose in your bloodstream at any one point, because your bloodstream should have a certain level of glucose. So when you're in that category of diabetes, that means that amount of glucose has surpassed what it should be in your system. And so one of the places that tend to absorb the extra glucose or sugar are our eyes, really. And so as diabetes become more uncontrolled, the eyes absorb all that extra glucose. And one of the areas that tend to take on the glucose are the lenses in our eyes. The lens is a natural. The lens is a part of an eye that helps us to focus images to the back of our eyes, to the retina. And so, as it absorbs all the extra glucose from your bloodstream, what happened is that it started making the lens very, very cloudy, and that's what cataract is. Just the cloudiness that shows up on the eye. It's not a new growth. And so when it gets all of that extra glucose, it becomes a cataract, literally. And in some cases, we even have a specific type of cataract that we call snowflake cataract, which is the pattern of the type of cataract that tend to result from diabetes, particularly if it's extremely high glucose, and you can develop a diabetic cataract fairly quickly when the amount of sugar in your system is extremely high. And so, yes, cataracts can result from having uncontrolled diabetes. The other thing is, you can have diabetes. It may not be super uncontrolled, but if you don't keep a check on it, it can still accelerate the process. And now we could be, some people develop cataracts a little sooner or a little earlier than we tend to see it. Like some individuals in their 40s, they have a cataract that's as if they were 60 years old and impacting the vision. And it's because of the diabetes not having remain under control, either typically for years. Okay, some people have their glucose fluctuate here and there, and it's just not controlled, and that's one of the impacts that can occur with the eyes in relationship with diabetes. And so, what can you do to prevent that? What are some of the things you do? One of the most important things is really to partner up with your primary care physician to really work on keeping your glucose, keeping your diabetic numbers down, okay? Keeping things under control over years will really reduce the chances of developing cataracts. It will slow down the process. It won't cause you to have cataracts so early in life. And so knowing your numbers, your A1C number, following all your instructions from your primary care doctor. So that's one. Number two is making sure you get your eyes regularly examined. And so with the eyes, diabetes can cause problems silently where you don't know it. And so by having regular eye exams, we can detect, changes that's going on in back of the eyes or to the lens, or if we can detect whether cataract is starting, and then we can have a game plan how to reduce that and slow that down. But it's very important that you get your eye examined as a diabetic at least once a year. Okay. I like to call diabetes one of those silent blinders as an eye physician, just because it can literally take away and steal your sight without you knowing over time. And so, and in some people, we can diagnose diabetes because they have acute vision loss, like acute blurry vision. All of a sudden the vision gets blurry, and lo and behold, it's because the sugar in the system just got really, really high. And so more reason to always get your eyes examined on a regular basis. So to answer that question, can diabetes cause cataracts? The answer is yes, but there's ways we can reduce that process from occurring so that you don't develop cataracts too soon than you really need to, right? Let age be the main factor and not diabetes adding to it. Okay, so if you found this video helpful, this information helpful, please pass it on, share it with somebody else. And if you have not had your exam this year, we're approaching the end of the year, please call us at 225-356-2655. If you are in the Baton Rouge area, I'll be more than happy to examine your eyes for you. And then we can go from there, have a game plan for your eyes moving forward. And if you want to check us out at www.lacenterforeyes.com. And please share, and let us know how you did. All right. Thank you very much. Bye-bye.